Hello everyone, Dr. Matt Ed. Today we're going to talk about what is T-wave memory. When you see T-wave inversions that are new on the EKG, the differential includes myocardial ischemia, ventricular overload syndromes such as strain pathology, Takotsubo cardiomyopathy, myopericarditis, cerebral vascular injury, and lastly T-wave memory, which we'll talk about. T-wave memory is described as transient T-wave inversion where normal ventricular activation resumes after a period of abnormal ventricular activation, and it is generally considered to be a benign finding. Causes of T-wave memory includes abnormal ventricular activation, and this is commonly induced by ventricular pacing, transient left bundle branch blocks, ventricular tachycardia, or intermittent ventricular pre-excitation such as WPW. So the direction of the T wave depends on the abnormal direction of the QRS complex. So the T wave remembers the vector of prior abnormal ventricular activation and reflects the direction of the wide QRS complexes after restoration of normal ventricular activation. The T waves will be positive in leads that had wide positive QRS complexes during abnormal activation, and the T waves will be negative in leads that had wide negative QRS complexes. T-wave changes persist for longer periods of time with increasing duration of the abnormal ventricular activation. For example, if a patient was paced for 10 minutes, transient T-wave inversions will last about 15 minutes after pacing has stopped. There have been studies where patients were paced for 2 years and the T-waves persisted for up to 18 months. There was a paper by Shipvilkin who found 92% sensitivity and 100% specificity for diagnosing cardiac memory when the following two criteria are met: a positive T wave in AVL combined with a positive or isoelectric T wave in lead 1, and precordial T wave inversion with larger magnitude than any T wave inversion in lead 3. Here is an example. There are T-wave inversions in the black arrows as shown. Here. So there are T-wave inversions in the inferior leads 2, 3 AVF and T-wave inversions in the precordial lateral leads V4, V5, and V6. This EKG shows a paced rhythm. You can see that 2, 3, and AVF have negative QRS complexes that are wide, and the precordial leads for V4, V5, and V6 are also has wide negative QRS complexes. Here the black arrows are pointing at the pacer spikes. This is a baseline EKG that was obtained 1 month prior to presentation, and it was similar to an EKG that was performed 2 months later, which showed resolution of T-wave inversions as indicated by the black arrows. In conclusion, T-wave memory should not be diagnosed as the cause of T-wave inversion until other causes are ruled out. Recognizing this may help to reduce unnecessary omissions, cardiac testing, such as coronary cath. This is my reference, and if you thought this video was helpful, please like, subscribe, and look out for my next video. Thank you for watching.